Good morning, YouTube. It's Precious. And I wasn't going to record today, but I was going through the mail and I received my psychological evaluation. So I wanted to share the results with you because I found them to be very accurate. Surprisingly, I've never been to a psychiatrist or psychologist, anything like that in the past. So this was all very new to me, and I just didn't see how me answering 160 or 165 questions was going to give them any inclination as to my mental stability. So, but I am pleased to say that this is pretty head on. I mean, reading it and I'm just like, that's me. That's me. They got it right. So, wow. I just wanted to share it with you guys. The psychologist that I went to see explained to me that previously they did a test that was about 200 questions or so, and it was very broad. It was all over the place, and a lot of patients weren't passing because it wasn't geared toward bariatric. So what they did was revised it, and they narrowed the questions down to where it's specific to a bariatric patient to, just determine whether or not they're mentally capable or stable to undergo the surgery. So it's called the Million Behavioral Medicine Diagnostic. And now I don't know if this is offered or other psychologists administer this type of test, but this is the one that Dr. Paul Carney gave. That's who I seen. And he's actually with Dr. Yuri's office in Elizabethtown. So this is definitely going to give you some insight to who I am, obviously, because it's so true. It says this is an objective assessment measure which may be helpful in identifying and appraising the potential role of psychiatric and psychosomatic factors in a patient's disease and treatment. So again, just basically to determine whether or not I'm mentally capable or stable to undergo the surgery. Basically, it says that I showed no, I don't want to read it word for word, but Miss Roberts produced a valid profile and appeared to answer the questions in an open and honest manner with no obvious distortions. So I didn't lie. Persons with similar profiles are not indicating significant psychiatric distress at the current time. I'm not crazy. This is just what I'm getting from it, Despite this, they may attempt to maintain an image of competitiveness and self-assertion. They avoid displaying weakness to others and will shun feelings of warmth, closeness, or intimacy. I definitely don't like to seem weak. I'm the oldest of 9. Okay, I've always felt like I've had to be like a protector or, like the second caregiver to my siblings. They think I'm bossy. I am kind of bossy. I am. I like to be in control because I don't like to be weak, because I think weakness can show vulnerability, and I don't like to be vulnerable because I think that it gives people the perception that they can take advantage of me. And I could be wrong in thinking that, but when I've become vulnerable in certain situations, I've always, been taken advantage of or, been left disappointed. So I feel like if I'm in control, I can control my outcome. So I don't like to be weak. So I think that is completely true. It says that they present with a distant and tough veneer. That's also true because a lot of my past coworkers or people I've attended school with can basically attest to, if you just see me walking, if I'm not smiling, then you would think I'm mad. You would completely think that I'm having a bad day or that I'm a complete bitch. And that's the truth. You have to really get to know people. I'm not going to just open up myself to you if I don't know you. Actually, I'm getting better with that. I'm really getting better with that. I'm starting to be more open and a lot more friendlier because I used to not be friendly. And I don't know why. I don't know why. I don't have that many like close friends. I've probably got two really close friends, Erica and Sammy. Other than that, everybody else I'm close to is family. I have people that, are friends, but we don't talk on a daily basis or we don't talk that often. So it's just the two, and they can definitely agree with this assessment, I'm telling you. So, where was I? It says that this may be some protection against some insecurities. Definitely. I've always been, it's so funny because the other day I put on Facebook that throughout high school and, whatever, I've always been that thick friend, heavy set or whatever. All my friends were skinnier. So I've had to be like the funny person or they actually seen me, perceive me as being confident. And it was so far from the truth because I would see them and just be like, why can't I be skinny? A lot of my friends, like, especially in college, going to the clubs and stuff like that, they would get a lot of attention from guys. And now, please don't get me wrong. I got plenty of attention too. Even as a heavyset woman, I got plenty of attention. But it's because of, I guess, my demeanor that I had at the time. Like, I didn't put up with any foolishness. And so I guess that kind of attracted them because I was really straightforward and honest. And I've always had a cute face. So, but I absolutely had insecurities, especially when it came to dating. I always, obviously, dating, a smaller guy and you think, okay, what is he with me for? What does he see in me? Like, I didn't see my worth. I didn't think that I was good enough, I'm not skinny or this and that. So are they trying to use me for my money or just for sex? I had all those things running through my mind. I would be thinking, well, they're probably cheating on me with someone skinnier. It really messes with your head. But my husband, he'll tell you that when we first met, I couldn't stand him. God, I couldn't stand him. He was so nice and friendly, and I was so mean to him. But yet he just, bless his heart, he just knew that that wasn't my true, inner self. So it's so funny because I've changed so much since then. And I guess it's with age, maturity helps with how you view life and other people. So I've changed a lot. It says that persons with similar profiles are accustomed to feeling strong and may react to significant illness and stressors with denial, indifference, or annoyance. If something is wrong with me, if I have a cold, okay, I'm going to push through. You don't have to go to the doctor for everything. That's how I seen things. I'm a mother of 3. And I don't know. Growing up as a child, we couldn't miss school. Okay, I don't care if you're sick. My mom will make us go to school. If you weren't, dying or, bleeding profusely, you was going to school. And you better not go to school and have that nurse call home. You're going to school. So I've just grew up that way, that if I can bear through it, then I'm fine. And I just don't like to go to the doctor. And that's not good because my husband's like, you need to go to the doctor. You need to do this. And I'm just like, okay, Preston, if you cough, you're going to the hospital. He's going to kill me for saying that. But I swear, it can be the littlest or the smallest thing, and he's got to go to the doctor. And I'm completely different. So actually, the psychologist told me that I can't be that way because with this surgery, if something comes up, no matter how little it is, I need to bring to someone's attention. So I got to really do better with that. And like right now, I've actually had a headache for the last couple days. and I've been taking ibuprofen. And it, of course, the headache subsides, but it comes back. So I guess maybe I need to go and see someone about that. My husband said it could be because I don't drink caffeine anymore. I just basically just stopped drinking sodas, period, because they told me to. And he said that maybe I need caffeine. I don't know. But I've been having a headache for a couple of days, so I don't know what that could be. Have you guys ever experienced that? Pre-op with the diet or anything like that? Have you experienced like the headaches? I don't know. I'll probably call and make an appointment today since it's Monday. We'll see. Then it says they tend to avoid the vulnerable and weak role of a patient, which is true. Like I just said, I don't like to be vulnerable. Trust appears to be a significant issue with such individuals. Absolutely. I have a lot of trust issues, which I've had to overcome now, at an older age. But in the past, I just didn't trust people. I didn't know what their intentions were. And it's because I've been hurt so much. I mean, I've had a difficult childhood, but I've been hurt a lot as well from not only just people in high school with the mean comments and stuff like that, or not just by past relationships, but I've been hurt by, adults. So, I just don't like to be vulnerable. That's just the bottom line. I don't like to be vulnerable. It also indicates that persons with similar profiles have strong religious and spiritual beliefs. Absolutely. I think that the only reason I've made it as far as I have and, haven't had any serious issues is because of the, power of prayer and my belief in God and my closeness with him. So I am definitely a Christian. I love God. I instill that in my children, my family life, and I think that all things are possible through him. So it indicates because of my strong religious and spiritual beliefs that this may be an asset with respect to recovery. Absolutely. 100% agree. They also tend to be open to receiving information or discussing matters pertaining to their illness. If I go to the doctor, I'm sick. Okay, it's because I can't take it anymore and I'm sick. So if they're giving me information about myself and my health, of course I'm going to take it serious. I'm going to listen. I'm going to follow their directions. I went to nursing school, although I'm not a practicing nurse because I did not pass my state boards. Okay. I went to nursing school, and one of the main reasons why people get sick or they don't heal fast is because of non-compliance. So I know that if a doctor is telling me to do something, to take a certain medicine for a certain amount of time, you have to complete it regardless of not whether you're feeling better or not. So no, I don't like to be non-compliant. I do as I'm told. Okay. And then it ends with, despite the above mentioned issues, Ms. Roberts does appear to be viable candidate for weight loss surgery at the current time. So that sentence there sums it up. I'm not crazy. I'm weak. Not crazy. Don't like to be weak. Don't like to be vulnerable. But I am a great candidate for surgery. So I was cleared by the psychiatrist or psychologist to proceed with surgery, which is great. I mean, I didn't think that I wouldn't be approved. I didn't have any doubt that I would pass that or whatever, but just the assessment from the questions was really interesting to me. This video is getting kind of long, but I did want to, and I'll probably do it in a separate video today. So I'll probably upload 2 videos. Just talk about the reactions of my family. I haven't sat my kids down and told them what's going to be happening to mommy in the upcoming months, but I am going to do that. And I'll probably have my husband record that so you guys can witness their reaction to that. Also, I want to put up some body shots because I haven't done that yet. So you guys can see what I'm working with right now. And yeah, so I'll probably do that in a separate video because this one is too long already. So thank you guys for watching. Thank you for all my new subscribers. And I haven't received a lot of comments under my videos, but I've been corresponding with individuals in my messages. So thank you to those individuals. And I've seen so many. Okay, first of all, on my first video, I said there was not a lot of people recording their journey. I don't know if I was looking in the wrong spot or not, because as of lately, I've been seeing so many individuals, so many journeys, like YouTube journeys. And I'm like, what? Where have these people been? You know, maybe I wasn't searching the right thing, but I've subscribed to a lot of new channels. And I mean, the weight loss community, you guys are so motivating and encouraging to each other. And I'm so excited to be a part of that. You guys don't even know. So I've been really trying to, you know, correspond with those individuals and give them as much motivation as I can, because I know in the upcoming months or weeks, I'm definitely going to need that same push, that same motivation and encouragement. So just good luck to everybody who's starting out on their journey, who's thinking about it. Just good luck. God bless you. And thank you again. Thank you again for sticking it out with me, for going on this journey with me. And stay tuned for another video later today. Okay? God bless, guys. Thank you for watching.